is Lucia Ryan. I'm a physical therapist here at the University of Vermont Medical Center. I work with the spine surgeons who do spinal lumbar fusion surgery. And I'm here today to teach you a class about getting ready for your lumbar spinal fusion. Now, normally I teach this class to a group of 5 to 10 people who come in, and we all sit down and it's more of a conversation. So today it's going to be me going through the slideshows. And the idea is at the end of this, if you have any questions, please call us here, okay? So we're going to get started, and you should be able to see the slides right next to me talking. And the first slide just says, getting ready for your lumbar spinal fusion surgery. So we want to welcome you here, and we're looking forward to taking care of you. We want to help you prepare for the surgery. We want to help you know what to expect during your hospital stay. And we also want to discuss your after-hospital recovery, okay? The whole idea is to try to make the whole process go as smooth as possible and make sure we've answered any questions that you have. Now, you all should have a book that looks something like this. And most everything I'm going to cover is actually in this book. So if you read through this, you're going to see a lot of the same information. But it's good to hear it both by reading it and by hearing it from somebody too. Okay? There's quite a team of people that get you through this process. Okay? We have the surgeons, we have the resident doctors, nurses, physician assistants, medical assistants, physical therapists, occupational therapists. There's quite a team that gets you through the process. Now, before surgery, there are things that you can do to make the whole process go better, okay? First of all, we want you to stay as active as you possibly can, okay? Stay active with exercise and normal daily activity as tolerated. Being active before surgery is going to help you. It's going to build up your stamina and help you in the after-hospital recovery. Stop over-the-counter medications that can thin the blood, such as ibuprofen and vitamins, a week before surgery. Please refer to your surgical paperwork for details if you have any questions on this. Eat a well-balanced diet. Do not go on a diet pre-surgery, okay? So this is not a time to decide to lose some weight. Continue all prescription medications unless otherwise indicated by your doctor. So make sure you find out what you can and cannot take right before surgery. You're going to have a nasal pre-op screen before your surgery. You should check with your employer or school to make arrangements for leave of absence. Now, I always tell people, try to ask for the most amount of time that you can, because if you have to extend what you've already asked for, it can be difficult. So just kind of shoot a little longer than you think you might need, and then when you need to back it up, it's a lot easier than doing it the other way around. Do not have dental work or cleaning 1 month prior to surgery or 3 months after. This is going to help prevent infection, so please do that. Check health insurance for physical and occupational therapy and equipment coverage. So after surgery, that you might need a few items, and you're certainly going to need some physical therapy, so please check to see what your insurance will cover for these items. Some people, not everybody, but a few are going to need to go to a skilled nursing facility or might need home health care, so you should figure out what you need for that, okay, or what your insurance covers. Cost of assistive devices, walker or cane if needed. Now, if you're going into surgery and you're not currently using a walker or cane, it certainly isn't the plan to have to use one for very long after surgery. So you should just see if there's some that you can borrow from somewhere, okay? But also, you might find out that you can get one pretty easily through your insurance, so you can check on that. Prepare your home for safety. Now, this is very important, okay? First of all, you may want to consider a temporary first floor living option or recovery center for when you first go home from surgery. Before you leave the hospital, they're going to make sure you can go up and down a few stairs. But you might not want to go up and down a full flight of stairs multiple times a day. So if you do have an upstairs bedroom, it's okay, you'll manage. but you might just want to go up at night and come down in the morning, okay? But if you can easily set up a first floor living arrangement, go ahead and do that. Now, you're going to want to place items you use regularly at waist level to avoid bending and twisting. So you're not going to be wanting to move forward and twist much after surgery. So just think about the things that you normally use. If you have some items in the kitchen you normally use, put them up on the counter. Set up a recovery center. Find a supportive chair. The chair needs to have armrests. Now, when you leave the hospital, you are going to be feeling a little woozy. Your legs aren't going to feel as strong as they might have before. So you're going to be using your arms when you push out of a chair. So you do up those armrests. The chair should have a firm cushion and the seat height that hits at your knee level. And then also, if you're the cook, prepare and freeze extra meals. So you're not going to want to be on your feet for a long time. So think ahead and put some things in the freezer. Other things, you're going to definitely want to arrange for a driver to take you home from the hospital. And you're going to want to arrange to have someone care for your animals when you are in the hospital and for a short time when you are home. And that's one of those things. Think about when you feed the dog or you're putting water in their container that you don't want to have to bend over. So that's something else you might want others to do for a while. Arrange for help for heavier house and yard work. So you're not going to be doing the heavier tasks. So get someone to mow the lawn, get someone to shovel that driveway. You're not going to want to do it. Plan to have assist for home care when you first get home. So when you first get home, you're not going to be thinking straight all the time because you've just been on those medications. And so I think it's really helpful to have someone there at first, okay? I also recommend people keep a list where they write down the medications they take those first few days so they don't get confused and maybe take a medication twice when they shouldn't. You're going to want to have some night lights and clear the path to the bathroom and tape down electrical cords and corners of space rugs and remove throw rugs. So you just don't want any tripping hazards, okay? Surgery is not a good time to trip after. So just make sure the house feels really safe and, get those things that you might trip on out of the way. So other things that you might need after surgery. So we've already talked a little bit about the walker and cane. So those are possible needs. There are some other items here that I have that are really helpful to have. And the next one on the list here is the long-handled shoehorn. Now these are really handy to have even if you haven't had back surgery. I have one. And they really make shoes a lot easier to slip on. You can find these at pharmacies in the area. The other item that's a lot like that just can generally be nice to have around is one of those long-handled reachers. So this has you can pick up things that are light off the floor, pick up things up that are that are a little bit high, and they're also really handy for helping to take off socks. So a long-handled reacher is a nice thing to have. Again, you can usually find those in a pharmacy. Furniture risers. So those are those 4 to 5 inch blocks that you can get at someplace like Home at Bed Bath & Beyond. That's the place I have found them before. So they are little blocks of wood that you would put underneath all of the legs of a chair to raise that chair up 4 or 5 inches. Elastic shoelaces are also helpful. Those are they're good because they can make a pair of tie shoes into a pair of slip-on shoes. A sock donner is not necessary, but if someone has one or you have one around, they can be helpful to help get those socks on where you don't have to bend over a lot. If you have someone that can help you, they certainly can help you put the socks on. And if it's summer, you can probably avoid putting socks on. Now, the one thing that is a must-have, and this is a definite must-have, is ice packs. So after surgery, you're going to have the incision and you have the trauma of surgery. And that's going to cause an inflammatory process. And your back is going to get a bit swollen. You'll feel some extra swelling back there. So putting ice on that 20 minutes at a time, 2 or 3 times a day, that first week you get home from surgery can be very helpful. You may not know how much help it is because it's going to help prevent the pain that you would get tomorrow, okay? So definitely make sure you have some ice packs. Now just realize when you are in the hospital, you will have a case manager that will be assigned to your case. And that case manager is responsible to make sure you are safe to go home and that you have the items you need to be safe to go home. So don't realize you're going to get some help with this when you're in the hospital. You don't need to know all of this ahead of time. So things that you're going to want to pack to bring to the hospital. You're going to want to bring some undershorts and underpants, loose-fitting clothes like sweats, shorts, t-shirts, short bathrobe, and slippers, eyeglasses, hearing aids, a CPAP if you use one, any necessary personal toiletries. Now they'll provide you with a toothbrush and toothpaste, but if you have anything extra that you need, please bring it. You're going to want to bring any braces or orthotics that you normally use. So if you usually use an orthotic in your shoe or a brace when you're walking, bring that along, because when they get you walking in the hallway, they're going to want to see how you walk with those in place, okay? Now, if you have a walker or cane, do not bring it ahead of time, all right? Bring it on the day of discharge. And very important is to label your personal items and leave any valuables at home. So what to do the day before surgery? Now, you're going to want to confirm what time you're supposed to be there. So usually a few days before, like on Tuesdays, I think the doctors usually meet and they set up the schedule for the next week. So you can expect a phone call a day or two before your surgery to tell you what time to be there. Again, do not eat after midnight. Do not drink any liquids after midnight. Bathe with the antibacterial scrub soap provided and use it as they direct. And if you have any questions at all, call that number 847-9005. Now, the morning of surgery, please arrive at the hospital at the time you were told, okay? You got to get there, you got to register, and then they'll send you off to the pre-op area. Now, you should bring something along to kind of occupy your mind while you're waiting for surgery. Occasionally, surgeries get delayed a bit, and you might be waiting a bit longer than you expected. So bring a book to read or music to listen to. Now, in the hospital, you can expect to see a number of different people. You can expect to see the physician assistant who is on the orthopedic floor. You can see the resident doctors every day. You'll see nursing staff. And you may or may not see the rehabilitation staff, just depending on how easily you get up and out of that bed with they'll determine if you need physical therapy or not. Now, you'll definitely get physical therapy after surgery, but while you're in the hospital, there's a chance that you may not. Now, during your hospital stay, you can expect to get up out of bed the day after surgery, and this may be with a nurse or a physical therapist. And very, very important here is do not attempt to get out of bed on your own. So again, after surgery, you're going to have had the anesthesia, you're going to be feeling a bit wobbly, and we do not want you to take a fall. So just be sure that when you get out of bed, you're with a nurse or a physical therapist. You will be seen by the resident doctors every day. And then another kind of odd request here is that they have found that chewing gum post-op can assist with getting your digestive system going. So if you're a gum chewer, bring along some gum that you like and go ahead and chew gum the day after surgery. As I said, it just kind of gets the digestive system going, and it can help move things along so you can get out of the hospital maybe a little bit earlier just by getting your digestive system going. Now, these are some exercises that, again, you look through this book here that you've got, and if you look in there, these exercises should be there. So if you're lying in bed and you're wondering to yourself, what can I do to make this process go better? I'm just lying here, what can I do? And the recommendation is that you do some things with your legs to kind of get the muscles working. So the first one listed here is ankle pumps. It's just moving your foot up and down. It's like you're putting your foot on the gas and you're taking your foot off the gas. You do like 10 of these in a row. Do 2 sets of 10 every hour you're awake. The second one is called the isometric quadriceps. Now that's the muscle right on the top of your thighs. It's the muscle that straightens your leg out. So basically, you're just going to straighten your leg as straight as you can, and you're going to feel that muscle on the top of your thigh tighten up. Okay, hold that for 5 seconds. Do 2 sets of 10 every hour you're awake. The third one there is the isometric glute sets. Those are those muscles on your back side. You're just going to squeeze your glutes together for 5 seconds and then release. 2 sets of 10 every hour you're awake. Now, these exercises are doing 2 different things. One, they're getting you to work your muscles, which is good because it's going to keep them strong. And second, it's helping the blood move through your legs. So by using the muscles, that makes the blood flow in and out of your legs more. And we want to do anything we can to prevent blood clots. So that's why you're doing these exercises. It's going to help move the blood through your legs and help prevent blood clots. Now you're also going to have those compressive sleeves on your legs that'll kind of pump up and squeeze your leg from the outside, and then it'll release it. That's working on preventing blood clots, but it's doing it externally. It's really good if we can do something internally. And by doing these exercises here, that's going to help move that blood through your legs. So do these exercises when you're in the hospital and even when you first get home from the hospital. Discharge from the hospital. You can plan on staying in the hospital until you reach functional goals to be safe at home. Now, what does this mean? What are functional goals? Well, functional goals are those things that you do every day to get around. So 1, walking independently. This might be with a cane or a walker, but that you can walk independently. Getting in and out of bed by yourself. Independently using the bathroom. Tolerating a normal diet. You'll have an x-ray to show that everything is in its place. Now that's not a functional thing, but that's something to let you get out of the hospital. You're going to have another x-ray, make sure everything is as it should be, and that your pain is controlled with medication that you can take at home. It's usually 2 to 3 days, and then you get to go home. Now, most people do go home. Sometimes when you're in the hospital, they'll determine that you should have home health services coming in, and that might be just nursing, or it might be nursing and physical therapy. And then other times, there are some people who need to go to acute rehab or subacute rehab, where they will get more intense physical therapy to make sure they're safe to go home. And those are usually the patients who have the larger surgeries, many levels are being fused, or maybe they're having a fusion that happens from the back side and from the front side. But most people do get to go home after 2 to 3 days in the hospital. Now, precautions after spinal surgery. You won't be doing this. You're going to want to be careful of bending and twisting and activity as tolerated, okay? So that just means low-level activity. And when you come in for your first physical therapy appointment at 3 weeks post-op, we will discuss how you're going to progress from there. So the first 3 weeks, you're really going to limit your lifting. When you leave the hospital, they're going to discuss with you what you're limited to, probably something like 5 to 7 pounds. And then the other thing is try to get up from sitting every 30 to 45 minutes. Do not stay still, okay? Don't get in that recliner and just hang back in it for 2 hours, because you are going to be very stiff when you get up. So you're going to want to get up every 30 to 45 minutes, do a little walk around the house, and then sit back down again. But just make sure you don't sit still for too long. Continued precautions. So other things. Driving. Now, you can start when you're off narcotic medication, walking comfortably, and your driving reaction time is back to your prior level. So that's usually, that can be beyond 3 weeks for some people. So no big rushing to get driving, okay? Sleeping. So this is a recommendation we have. We want your spine to kind of stay neutral as neutral as you can. And these are the recommendations. So if you're lying on your back, you're going to want to pull a pillow underneath your knees. And if you're lying on your side, put a pillow between your knees. These may be things that you already do now. And then again, we are going to remind you here, no dental work for 3 months after surgery. We do not want any kinds of infections, so no dental work. So now, other precautions. This one is actually one of those that most people don't realize unless someone has specifically told them and usually reminded them about a few times. You do not want to take any of these following medications for 3 months after surgery. Ibuprofen, which you find in Advil or Motrin. Naproxen, which is found in Aleve and Mobic. And these are all anti-inflammatories. There might be a medicine that you're on a regular basis right now, but these are medications that you should not take regularly after surgery because they slow down the fusion process. Now, Tylenol's okay. And, you might be directed by your surgeon that it is okay to take these medicines, but please check with them. Don't start taking Advil on a regular basis after surgery, okay? So home recovery. You're going to want to conserve energy. Well, not only that, you're going to be tired, okay? So you just had a big surgery. And when you have this type of surgery, your body feels like it just went through a train wreck or something. You're going to feel kind of tired, you're going to feel a little beat up, and you're just not going to have a lot of energy. So don't plan on any big projects. So conserve your energy, move frequently. You can start light housework when you feel ready, and that's usually 5 to 7 days out. And in my mind, light housework is things like making a sandwich or maybe folding the laundry, just really light tasks. Take pain medication as prescribed, use the ice and cold packs, that's a must. And again, do not plan on any big projects during this period of time. Now, other things with your home recovery. You need to be walking. The doctors love it when you walk. That's the one thing they tell every patient to do. Get up and walk. So our recommendation is that you're walking daily, starting with 3 to 4 short duration walks. Build up to 10 to 15 minute walks 1 to 2 times per day by 3 weeks. Now this might not be for everybody. Everybody goes into surgery with certain restrictions and comes out with certain restrictions. So all I ask is that people try to start with a couple of short walks a day. Now for somebody that might be a 2-minute walk. For someone else that might be an 8-minute walk, okay? Just start with a few short walks just in your house and then try to build them up over time. If it's winter, I recommend people to turn on the timer in the kitchen for 4 minutes and then they just walk laps around the house for 4 minutes, and then they did that okay. The next day they can increase it to 5 minutes, and that's a way of tracking your progress, and it's always nice to know you're making progress. Now do your exercises, and if you're prescribed home health, you should get a call within a couple of days of being home. Now, do not be surprised if you are sore in other places than your back. Often people have anterior trunk soreness from positioning during surgery. So just realize when they're doing the surgery, you're going to be lying on your stomach for quite a while. They will pad you up really well, open your hips and your shoulders, but it's still a position you're not used to in being in for hour after hour. So you might have some soft tissue soreness that you are just going to need to realize it's going to take some time to feel better, but just don't be surprised if that happens. So pain medications, the doctors here will prescribe pain medications for you for 2 to 6 weeks following surgery. For some patients, if their doctor is a doctor that stops at 2 weeks post-surgery, you should probably have a conversation with your primary care doctor about, I'm going to maybe need some pain medications following the surgery, and my surgeon wants me to get it from you. So you might want to call them up and discuss that with them. Ice is very helpful to manage pain and inflammation. There we go. 3rd time we've mentioned it, so don't forget to get those ice packs. Now be active, because remember again, staying in one position for too long can be uncomfortable. So just remember, just do light level tasks, but don't sit in that recline for hour after hour because you're going to be stiff. And then remember to do the instructed exercises. So the incisions care. So all will have internal stitches, and then the way it's closed at the end may vary. Some people will have external staples or stitches or glue. Now, what's important is if you're one of the ones that get staples, those need to be removed at 3 weeks post-surgery. And that can be done at different places. If you live far away from here, that can be done by your primary care doctor. If you live close by, you can come back here, and the nurses here will do that with you. And 3 weeks happens to be the time that most of you will be coming here for your first physical therapy visit, so you can do it at the same time. Now, if you're having home health, they can do it for you. The home health nurses can do it for you. So it may vary. The important thing is, if it comes to 2.5 weeks, and you don't have a plan about how to get those staples out of your back, call us here and we'll help you figure it out. The incision will be covered when you leave the hospital. You may remove it in 2 to 3 days. If it's still draining, cover it again with a sterile bandage. And if you're having home health, they'll come in and take a look at it and help you with the incision care. Now, it's normal to have mild local redness, some swelling, and some bruising, but if it's still draining over a week after the surgery, call us, okay? Again, a reminder that the home health nurse will care for the incision by changing the bandage when they are there. And then a very big reminder here. No baths, pools, or hot tubs until the incision is completely closed. So no immersing yourself fully in water until that incision is closed, okay? You can take a shower about 5 days after you get home from the surgery, but just be sure you don't pelt your back with a heavy shower, okay? Look and keep an eye out for signs of infection. So the main signs of infection that you're looking for is excessive drainage, odor, or spreading redness, okay? And also if you're running a fever. So those are all things to keep an eye out for. If you're concerned at all, give us a call here at the 847-9005 number. Outpatient physical therapy after surgery. So we here at the Orthopedic Specialty Center have a protocol with the doctors that your first couple of physical therapy visits after surgery are here. And there's a reason for that. That's because the nurses are here and the doctors are here. And if we have any questions or any problems, we can go and we can get quick answers. So you will be referred to physical therapy. If you're having home health, physical therapy will start there. And therapy goals are based on your functional needs. So we will focus on motion and strength, pain management, work tasks, recreational tasks, home and yard tasks. Now, not everybody's physical therapy program looks the same, and that's because everybody's goals are different. So that's why we need to know what your goals are, and we will work on getting your program designed for you. So your rehabilitation plan will be determined by what your physical goals are in regards to work and functional tasks. It's important to communicate with your physical therapist as to what you want to get back to. So that patient who wants to get back to a job that has very heavy liftings, their program is going to look a lot different from another patient who just needs to be able to do some light gardening and plans on being able to go to the movies. So everybody's physical therapy program in the long run will look different. So this is what the protocol looks like. If you are having 1 to 2 level fusion, you will be seen here 3 weeks post-op to see a physical therapist. And I always call that visit to patients me taking a snapshot of what you look like. We basically want to see where you're at. And then again, we're going to discuss where you want to be 3 months from now or 6 months from now. There isn't like we do a lot of exercises in that session. It's a pretty mellow session. It's really about gathering information and then giving you a few exercises. So don't be afraid to come in, okay? Then at 6 weeks, we have another visit with you, and that coincides with seeing the doctor and having an x-ray. And this is also when we see the patients for the first time who are having one of those larger fusions. So a few patients don't get seen in physical therapy until they're 6 weeks out, and those are the patients who are having more multi-level fusion, more like 5 levels or 6 levels. And then again at 12 weeks, we have a physical therapy visit that coincides with seeing the doctor and getting an x-ray. Now, at 6 weeks post-op, we might decide that you're ready for more regular therapy. And then if you live far away from here, we're not going to have you come here. We're going to help you set it up closer to home. This is also a time when people who, if they've had pool therapy before, they're probably ready to go back to pool therapy. By then, the incision is fully healed. So at 6 weeks, a certain percentage of patients go off and do more regular therapy closer to home. A few of them come here too. Just depends on where you live. So we're winding down here. This is the reminder of what to be concerned about, signs and symptoms to be concerned about. So first of all, if you have new or unexplained calf pain, excessive drainage from the incision, new spreading excessive redness, new unexplained increase in swelling, and fever. If you have any of those, call us here at the 847-9005 number. Now, if you have either of these, difficulty breathing or chest pain, you want to call 911 or go directly to the hospital. So what we're having you watch out for is first signs of infection. That would be the fever, the excessive drainage, odor, things like that, which might indicate that the incision is infected, and that would need taken care of, okay? Now, the other signs we were talking about, like the calf pain or the difficulty breathing or the chest pain, those are signs that you may have a blood clot, and it may have moved onto an area where you do not want it in your lungs or in your chest. So please, if you have the difficulty breathing and chest pain, don't call us. Go directly to the hospital or call 911. So that pretty much is it for the class. And again, when I'm normally teaching this class, I have a room full of 5 to 10 people, and this is a time when they ask questions. So right now, what you need to do, if you have any questions, is pick up the phone and call 802-847-9005 and ask to talk to a nurse or a physical therapist to ask your questions. Now, I do have a couple of questions that have come up in the past, and I just thought I'd list these off here. We do get a number of people that come a long distance, so this one is for them. Is there a recommendation on a place in the area for relatives to stay while the family member is in the hospital? Well, many of the hotels in the area do give a discount, so we do have a list of that. If you want that, you can call us and get it. And then my other recommendation is that you can call some of the hotels that are on Williston Road in South Burlington, and many of those are the hotels that are listed on the sheet, and just ask them, do you have a rate for family members of someone who's in the hospital, and they can give you that information. And then the other question here is about the parking situation. What is the parking situation for relatives and friends at the hospital? Well, we have that parking garage, as you know, and it costs money to park there. There are coupon books available to decrease the cost of parking in the parking garage. If you have any specific questions, please call the UVM Medical Center Security at 802-847-2812 or inquire at the payment booth at the garage. My other little suggestion here is if you have one of those handicap tags that you hang on your car, you actually can park for free. So if you have one of those, please put it to use. All right, that's it for my commonly asked questions. And that winds us right down to the last slide. So I really want to thank you for watching this. I hope that you got some valuable information from this. Again, most of this information is in that booklet that you have, and you can look through that. And we welcome the phone calls to ask us questions. And I'm looking forward to helping you out after surgery. We have 4 physical therapists here. I'm one of them that sees you after surgery. So I hope all goes well for you, and we're looking forward to seeing you here 3 weeks after your surgery. All right. Thank you very much again for watching this.